Good evening and thanks for joining us. We begin with red flags being raised about the health and well-being of our children. They'd usually be wrapping up classes now, going to graduation ceremonies and looking ahead to summer jobs and camps. That's all changed this year. And doctors at Toronto's Sick Kids Hospital, the biggest pediatric institution in the country, say the loss of these important moments of social development could have a worrisome impact. Mike Armstrong has our top story tonight.
You could probably visit any park in Canada and find some kids pretty pumped about school being cancelled.
It's the best thing that ever happened in my life.
But as things have dragged on, more and more are missing classes and everything that comes with it. This girl says she hates the coronavirus because she can't see her friends or her teacher. Well, there is a growing chorus of experts who say keeping kids at home is doing more harm than good. Remote learning and Zoom meetings aren't enough.
Okay, good morning, everyone.
A panel of experts at Toronto Sick Kids held an online press conference Wednesday with the message that children can't wait for a cure or a vaccine against COVID-19.
It's going to be around for a long time. And the alternative of having children not in school for months and potentially a year or two are just untenable.
Now, the panel doesn't question the decision to close schools back in March. Knowing what we knew then, it was the right move. But it says we now know more. The danger of holding classes doesn't seem as bad as originally thought. Children don't catch the virus often. They're only about 5% of all cases in Canada. And when they do catch it, generally it's mild. There have also been studies around the world showing kids don't really put teachers at risk.
Generally, what we see is children get infected from adults and not the other way around.
Now, the panel says governments are underestimating the impact of canceling school. There are the physical problems, kids aren't as active, but there's also the mental side of it.
A significant proportion of children have experienced increased depression, anxiety, irritability.
Not having kids in school means vaccines aren't happening when they're supposed to, and learning disabilities aren't being diagnosed as early as they could be. The panel says elementary and high schools should reopen in the fall with precautions, things like more hand washing and screening for symptoms. But it says being strict about physical distancing or masks might have a negative impact and increase anxiety.
I think as a general statement, we don't think that masks should be required.
One thing the panel says would help is telling families and children when they're going back. Just getting periodic updates means waves of hope and disappointment, and again, only increases the stress. Mike Armstrong, Global News, Montreal.
Many kids weren't physically active before this pandemic. Now things are even worse. A report card from the nonprofit group Participation gives Canadian kids a D+ for overall physical activity. That's based on 2 years of data ending in February. It found 39% are getting at least 60 minutes of moderate to vigorous physical activity per day. That's the minimum to maintain healthy living. No surprise that screen time is a big factor in children's sedentary behavior, which also scored a D+. Participation says parents need to lead by example. They need to set limits for the amount of time kids spend with devices, make a point of setting aside screen-free family time, and not allow screens in children's bedrooms. That not only invites more usage, it also affects the amount of sleep kids get.
Sunday on Coronavirus, the new reality.
40 to 60% of employees want to work from home 1 to 3 days a week.
The pandemic redefines the workplace.
It's cleansing them.
A sneak peek inside the office of the future. Sunday at 7 on Global.